Suppose a middle school received a grant from Department of Education PEP that emphasized raising the bar in PE. In this program, decisions are made by principal and PE teachers. The ultimate goal is to promote children's physical and psychosocial health by quality PE. In this case, Department of Education requires a report on the implementation and effectiveness of the programs for which they provide funding. To prepare such a report, researchers conduct a program evaluation. In essence, program evaluation is applied research, as it evaluates an ongoing program. With program evaluation, we apply the research directly to decisions regarding the program that is being evaluated, and make decisions whether to continue funding the program and whether to modify it. Second, new programs are based on needs assessment, determining the practical needs of those being served by the program. For the PEP program, we may ask questions such as what types of movement skills do children need to acquire? Third, the program, which is similar to the treatment in experimental design, are usually subject to change during the course of the evaluation. For instance, for the PEP program, it is designed to give PE teacher a major role in decision making, with children no choice making. If, in the midterm, it is found that children are seeking more autonomy and more choice, adjustments may be made in the program. The evaluator collects such information is called formative evaluation, collecting information that may lead to changes in the program during the evaluation. When evaluators collect information about participants' attainment of the ultimate goals at the end of the program, the activity is called summative evaluation. A summative evaluation contains information about the final or long-term benefits of the program for its ultimate clients such as students. Summative evaluation often involves comparison to a control group. This is not a random assignment control group but usually an external group. Final program evaluation report include overview of needs assessments and results from the formative evaluation, as well as the data on the summative evaluation. This report should also include recommendations regarding extending the program in the future and recommendations for improving the program's implementation. Suppose you were on the board of a foundation that was giving a grant to a social welfare agency's program. Would you prefer to have the program evaluated by an employee of the program such as the program director or by an external, independent evaluator? Why? Assuming that the program director has been trained in program evaluation. A program director might be more familiar with a program than an external evaluator and may be in a better position to evaluate it. On the other hand, an external evaluator may be less likely to have biases regarding the program and might bring different perspectives to its assessment. Of evaluation are interlaced with the overall program development and delivery. The who, what, where, when, why, and how questions are answered in this phase. Who is your target audience? What do you want the target audience to do? When do you want them to do it? How will it get done? Who is in charge of what aspects? In these early steps, the logic model for evaluation should be developed and refined because it will assist in evaluation as well as overall program development. Logic models are useful tools to guide evaluation strategies as well as to help overall planning for program design and implementation. What is a logic model, and does it apply to physical activity interventions? A logic model is fundamentally a description of the processes and interrelationships that can lead to a result, cause and effect. A logic model can be graphic or narrative in its depiction of these relationships. The most fundamental use of a logic model is to ensure consistent communication among project personnel and stakeholders. Logic models provide the hub around which all evaluation activities for a physical activity promotion evaluation can be linked. Logic models describe and define the relationships among resources, the target population, short-term and long-term effects, and the ultimate desired outcomes. A well-constructed logic model helps everyone involved or interested in a project work from a consistent set of terminology and gain a common understanding of the intended and unintended consequences of a program or policy. The logic model helps to drive program and policy evaluations in a timely manner when coupled with a project timeline. A schematic of a generic logic model for program and policy evaluation is demonstrated on this slide. The interrelationships of interest actually begin in the lower right-hand corner of the model in the area labeled Ultimate Goal. In fact, it is sometimes easier to build a logic model from right to left rather than from the more natural left to right. The ultimate goal of most physical activity promotion programs and policies, although not often measured in the context of specific programs or policies, is improved health for the participants. This could be determined by examining risk and rates of disease or mortality. Although such outcomes are central to the reasons for promoting physical activity, clearly waiting for some of them to happen, or not to happen, can take years and is beyond the scope of measurement for many programs and policies. Of note, each of the 4 ways to evaluation a physical activity program or policy detailed in the preceding section is part of the evaluation framework and is overlaid onto the logic model schematic. Outcomes, which are clearly of interest in a physical activity program, are presented schematically in this figure immediately above and before the ultimate goal. Outcome can be conceptualized in terms of time. What can be expected shortly after program implementation? What can be expected after short-term outcomes or mid-term or long-term? Moving to the left of the model, the logic model is also used to define the processes of both the program and the target populations. Next in the figure to the left is resources. A thorough understanding of resources is critical to include in a program evaluation. The success of a physical activity program or policy often rests largely on its evaluation design. Physical activity program evaluations can be experimental or observational in design. Each has strengths and weaknesses. What is one fundamental difference between experimental evaluation studies and observational evaluation studies? A fundamental difference is that experimental studies include randomization. With randomization, people, groups of people, or places are randomly assigned to the program treatment or to a control, i.e., not receiving the treatment. When experimentation is not possible or impractical because of costs or other barriers, observational evaluation studies are a useful alternative. Often referred to as quasi-experimental designs, these programs differ from experimental ones in that they are not randomized. Groups are divided into treatment and control based on convenience, receptivity, targeting, and other factor. Without data, there is no evaluation, only opinions. The data sources can be quantitative and qualitative, and must help answer specific questions. The dose-response analysis. What type of data might be collected for both quantitative and qualitative sources? A dose-response analysis helps answer the question: does the response to a physical activity program or policy, i.e., participation in physical activity, depend on the dose of the program or policy to which a person is exposed? Data sources that may be collected for program evaluation can be quantitative. For example, questionnaires, attendance sheets, delivery logs, production schedules, training manuals, or qualitative, for example, interviews. Evaluation plans and data analyses are useless unless the findings are communicated. Communication targets for evaluation results should include immediate stakeholders, with the first priority being those who provided the funding. Often overlooked, but equally important, is the communication of key findings to program participants. As key stakeholders in a physical activity promotion program, participants should be informed all along the way, including receiving a full briefing on the outcomes of the project. Data from well-designed physical activity evaluation projects strengthen our understanding of cause and effect. The format of communications will differ depending on the needs of the audiences.